the office visit here. Christine, if this patient for the office visit for the knee needs x-rays and treatment today, or can we fit that into the schedule? Yes or no? Okay, thank you. All right, Miss Janet, you can come right this way with me. My name is Amber. It's a pleasure to meet you.
Hi, Amber.
You're going to have a seat in the brown chair for me. Thank you. All right, how are you doing today?
I'm sore. How are you?
Fantastic, thank you. I'm sorry to hear that you're sore. So it looks like Dr. Hunter sent you over this way to see the nurse Renee because you had a flare-up of your knee.
Right.
What's going on with your knee?
It's popping and it hurts.
Okay,
Lot of
and
pain.
which knee is that?
Left knee.
Your left knee, okay. Your right knee doesn't bother you?
Sometimes, but
Okay.
not a whole lot.
Occasionally?
Mhm.
Okay, good deal. Now, whenever your left knee bothers you at a scale from 1 to 10, 10 being the worst when it's at its absolute worst pain, how would you rate it?
Probably a 10.
Okay. And how long has this been happening? Long time?
A long time.
Okay. And do you know what caused this knee pain? Did you have like a trip
I
or a
fell.
fall?
Mhm.
Okay. And when did you fall?
About 5 years ago.
5 years ago? Okay. And if you don't mind me asking, how did you fall?
Tripped over the dogs.
Alrighty, good deal. And is your knee pain all the time or does that come and go?
It's all the time.
Okay. And can you describe it for me? Dull ache, sharp stabbing, burning, numbness, tingling?
Sometimes it's pretty much all of the above there.
All of the above?
Yeah.
Okay. Alright. And do you ever feel like your knees are weak or like they're going to give out on you?
Yes, they have.
They have before?
Mhm.
Okay. Does that cause you to fall? Is that what caused your fall?
I never hit the ground, but I did. My knee caved in.
Okay. And is there anything that aggravates your knee pain? Any walking or standing for long periods of time?
Walking and standing definitely.
Okay, what about bending?
Yes, I can't really bend well.
Is there anything that makes your knee pain feel better? Ice, heat, medication, topical creams?
Usually Motrin.
Motrin, okay. And have you had x-rays or MRI of your knee in the last 6 months?
Not in the last 6 months. No.
Have you ever received physical therapy for your knee pain?
Yes.
Okay. Did it help?
No, they actually broke my femur.
Alrighty, and how long did you do physical therapy for?
Probably about a month and a half.
Okay. And have you had any surgical procedures performed on your knees?
Yes.
Okay, which knee?
Left knee.
Your left knee? Your right knee, you haven't had anything done?
No.
Okay, what did you have done on your left knee?
Meniscus. Torn meniscus.
Okay, did they just go in and clean it up?
They did.
Okay.
But they say I need a knee replacement.
Okay. All right, good deal, Janet. Well, I am done with this part of the exam. What I'm going to go do is go get the nurse practitioner. Before I do that, I'm going to take your blood pressure real quick.
Okay.
I will be right back with the nurse, okay?
Okay, thank you.
All right, you're very welcome.
You've been great.
Thank you. All right, hang tight for just a moment. Relax your arm for me, and I'll be right back.
Okay.
Alrighty, Miss Janet. Let's just pretend that this blood pressure is steady. Alright, Janet, if you would do me a favor and go ahead and lie face up on the table, and if you could please expose your knees so that the nurse practitioner can perform her exam on you.
Okay.
Just in such a way that your knees are exposed, okay?
Both knees?
Yes, ma'am. She's going to do both knees just for comparison, okay? I know your left knee is the only one that really bothers you, but we'll look at both just to...
Don't mind my white legs.
All right, good deal. I'm going to go grab her and I'll be right back, okay?
Thank you. I'm coming right in. You ready for me?
Yes,
Hi.
ma'am.
Hi. Hey there.
So Janet, this is Renee, our lovely nurse practitioner.
Hi, Renee. Hi, Janet.
Miss Janet fell years ago and tripped over her dogs. Her left knee really bothers her, her right occasionally, but it's mostly her left knee. Rated as a 10, sharp, stabbing, dull, ache, stiff, all of the above. She does feel like her knees are weak. They do give out on her all the time. Things like walking and bending irritate her knee. She did do physical therapy. They ended up breaking her femur doing so. Let's see here.
We won't do that to you, Janet.
Thank you. She did have a left meniscus tear, so they went and cleaned it up on her left knee, and they told her that she needs a knee replacement.
Oh dear. So you definitely have some osteoarthritis going on.
Yes.
Huh? I'm sorry, Amber, if you told me when were your most recent knee X-rays?
Oh, I'm sorry. She has not had any.
Okay.
Not recently.
Not recently. No treatment here ever before for
No.
the knee. Okay, and it's your left one, right?
Yes.
Okay, very good. Well, we're just gonna do some tests here, and I hate to even move it around when it hurts so much, but it's gonna be important that we find out exactly what's going on right now,
Thank you.
okay? So first, I'm just gonna take a look here. Yeah, it looks like this left knee is visibly swollen, and yeah, I see that little scar there from your surgery, and it's warm too. It's been cooking, huh? Yeah. So those will be all my inspection findings. Okay, Janet, what I'm going to do is I'm just going to feel on around your knee joint. Let me
Okay.
know if you have any discomfort where I'm touching, okay?
For the pants up high.
Not really. Honestly, we probably will have to gown most people, because it's just as uncomfortable even for you. So I would just feel around. And how does that feel there? Is that sore?
Sore.
Okay, so that's some pain on the lateral side of the joint. And how about the inside of the joint there?
Little sore.
Okay, so I'd say mild on the medial and maybe moderate on the lateral. And how about here?
No.
And nothing on the patella. Okay, now we're going to just do another test for swelling here. So sometimes fluid likes to hide behind the muscle here, so this is really important. You really do have to expose to there because you're supposed to push the fluid down out of the pockets of their muscle. So we're going to just go like this and do a little test here. And when you tap in the kneecap, there's fluid there, it kind of bounces, and that's so. So yeah, she does have some visible swelling, but negative allotment. And so now what we're going to do, I'm just going to take a look at the other one. So do you have osteoarthritis in this knee too?
Yes.
Okay, is that tender at all?
No.
Okay, and how about this side of the joint?
No.
Okay, might as well go ahead and check it since we're looking at it. And does this knee ever swell?
Not usually.
Okay, all right. Yeah, so that'd be negative allotment on that side, and it doesn't look like you've had surgery or anything, so it looks good. Okay, so I'm gonna just pull these down so you don't have to be uncomfortable anymore. We're just gonna look at range of motion. So what I'd like you to do is take both of your feet and pull them, bend your legs and pull your feet back towards your bum as far as you can comfortably. And yeah, put them right down there. Okay, is that as far as you can?
Yes.
Okay, any pain or discomfort?
Just in my.
Oh, just in your back, okay. So yeah, it
A little
looks
bit of
like,
pain right here.
yeah, it looks like she's a little bit restricted in flexion because this leg doesn't come quite as far. So flexion on the restriction and pain on the left. Now I'm just straighten your leg out. Any pain or discomfort? Oh, a little crepitus, huh? So normal extension on the right. And how about pain or discomfort?
No.
Oh my goodness, patellar grind on both. I was gonna sit you up to do that, but we already got that out of the way. And so now I'm just gonna move your leg in different directions. Let me know if there's any pain or discomfort.
Okay.
Any discomfort there?
No.
Okay.
No.
So abduction and adduction are negative on the right. And how about pain or discomfort there?
No.
No, okay. And also negative on the left. So now I'm gonna bend your leg up here. I'm just gonna sit on your foot a little bit. I'm gonna pull towards me. Any pain or discomfort?
No.
Okay, I'm gonna push. Any pain or discomfort?
Mm-mm.
I'm looking for like laxity too. That's Apley's, I'm sorry, that's the anterior drawer. Yeah, I'm drawing a blank. Yes, that'd be negative anterior and posterior drawer on the right. Now we're gonna do the same thing on this side here. Any pain or discomfort here?
No.
You do have a real knee problem, don't you?
Yeah.
Oh, I better not yank you
You're
out.
fine. It's fine. I'll let
Any
you know.
pain or discomfort there?
No.
Okay. So negative anterior posterior drawer on the left. And now we're going to take this up here. This is the one that, okay, so we're going to rotate your leg in and lay it down. Any pain or discomfort?
No.
Okay. That would be McMurray's with internal rotation. So bend one more time. And I'm not really
Tight.
sorry. And now, how about with this?
Just on
Pain,
the back.
pain or discomfort? Okay. So that, if I was probably doing that full force, it probably would have hurt you. But we're looking for basically popping, clicking, or pain would be positive. And so we'll go ahead and just do the other side here. So you lift your leg up like this. And pain or discomfort with that? Oh, sorry. And pain or discomfort with that. And that would be negative McMurray's with internal and external rotation on the right. Okay, the last thing we're going to do, I'm going to have you flip over onto your belly, okay? For
Okay.
2 more knee tests, and I'll move this right out of your way, give you a little place to breathe. And we're almost done, okay?
Okay.
Okay, and so we'll start now with your good leg over here. And I'm just going to put a little pressure here. I'm going to lift up on your leg and rotate. Any pain or discomfort with that?
No.
Okay, now I'm going to put some pressure down and rotate again. Pain or discomfort there?
No.
Okay. That'd be negative Apley's distraction and compression on the right. And now, any pain or discomfort here?
No.
Okay, any pain or discomfort here?
Mm-mm.
Okay. All right. So that would be positive or negative Apley's distraction or compression on the left. All right, Janet, you made it through. Let's sit you on up.
Thank you.
Okay, what we're gonna do now, since you haven't had pictures in a little while, and since you fell or whatever you did, I don't even remember. You fell. Okay, good. Drunk at the bar again. Yeah, we should take a little picture of the joint and see what's going on, and that'll give us a much better idea of what we can do to help.
Okay.
And in the meantime, then I guess depending on what was set up at the front desk, if the patient was in excruciating pain and was like, can I get some treatment now, regardless of whether or not there's OA, if the front desk is authorized that they have coverage or whatever, we could go ahead and do a lidocaine injection because that would be indicated with or without OA. So in that case, the nurse practitioner could say something along the lines of,